All right, we are live. Thank you guys for tuning in. I'm Lasharte Scott, CEO and President of Scott Center for Observation, Treatment, and Transition. And we have Dr. Lametra Scott, who is the CEO and founder of the nonprofit organization Breaking the Sickle Cell Cycle Foundation. She is also a pharmacy consultant and a mother of a sickle cell warrior. Thank you for joining us tonight.
Thank you, Lasharte, for having me. It's a pleasure to be here.
Yes, so I want you to kind of tell the audience just I mean, I know I gave like a brief overview of who you are, but I
Uh-huh.
think I didn't do justice. I think it's best when, you can kind of tell the audience how you got into sickle cell and what it
Uh-huh.
is that you do. Why did you start this foundation?
Well, I can say that I didn't plan to get into sickle cell. This was not on my vision board. It just happened. And sometimes, in life, things just happen. So for me, I found out that I was a sickle cell trait carrier actually when I was pregnant. So I didn't know all this time that I was a trait carrier. Now, granted, I was, I think, 31 when I had my son. So you would think that in that time span, that it's somewhere along the lines, I would have been informed about the fact that I was a sickle cell trait carrier. But nevertheless, I was not. And the same thing for my son's father. He wasn't aware that he was a sickle cell trait carrier prior to my son being born. So that was kind of I would say, a news flash for us, considering the fact that neither one of us knew that this was a possibility. And then all of a sudden, with our first child, that's the fate and the cards that were dealt. So fast forward to after that, after my son was born, they do have the newborn screening, of course, that is available. But I never knew the results of the newborn screening. I just knew that I needed to have him tested after he was born to find out whether or not he had sickle cell disease. Well, I did that. And I actually started interviewing pediatricians before he was even born. So while I was 7 months pregnant, I was running around trying to find a pediatrician that could take care of a child who had sickle cell disease, just trying to be prepared, because that's for me the way that you handle almost anything in life is prepare as much as you can. So that was my way of doing my homework and getting myself prepared if this was the case. Well, I went to that a particular pediatrician. She came highly recommended, and she did the screening for my son. He was probably about 12 weeks old, between 10 and 12 weeks at that time. So he was far beyond that early newborn stage where you could get false negative information. So the time that I took him was typically during the time where your body is now making whatever adult hemoglobin is going to make, or either it's making hemoglobin S. Well, we had that testing done, and the results came back, and she called me and she says, "I have great news, Dr. Scott. Your son doesn't have sickle cell disease. He only has sickle cell trait, so he'll be fine." For me, I was like, "Oh my gosh, I'm so excited. This is like a breath of fresh air." I felt like the load had been lifted off of my shoulders. Well, fast forward a couple weeks afterwards, I started to get calls from the health department. And I couldn't really understand why, because they were calling me on the phone. I got letters in the mail saying, "You need to bring your son in for confirmation testing and screening." And I really didn't know why. At one point, I thought, well, maybe they just didn't get the information from our pediatrician. Maybe the pediatrician's office just didn't send the information over to the health department and they just haven't caught their records up. So when I finally did talk to a representative from the health department, and I told her that we had already done that testing, and she says, "Well, I'm sorry to inform you that based on the newborn screen that was done the day that your son was born, it actually indicated that he has hemoglobin type SS. And we need to get you connected to care. We need to get you in with the hematologist. There are prophylactic medications that your child needs to be on because of the immunocompromised situation, that's going on." So for me, that is my introduction into how I got into the world of sickle cell disease. It's almost like somebody snatches the rugs out from under your feet, because you are now thrown into a situation that you are not prepared for at all by any means. So that for me was the first inclination that all healthcare providers are not well versed in sickle cell disease. It was also a combination or something that I became aware of because of my own ignorance of the fact that I had sickle cell trait. So for me, in working in the healthcare field as a pharmacist and at my job, I do managed care pharmacy, and I had been doing managed care for a long time. After graduating from pharmacy school, I went on to do residency training specifically for managed care. And in my job, what I did was disease state management and educate providers on how to manage various disease states in a cost effective way without compromising patient outcomes. So I took that skill set and what I did for work and I turned it to sickle cell disease because what I wanted to see was a place where I could bridge that educational gap. And that's what I saw we needed. So that was my way of, for me, what I see now is coping, a coping mechanism that I developed for my own self in handling the situation was being proactive. What can I do in this situation to help somebody else not have to go through these same things that I did just because of the lack of education that's out there? So that's a long story made short in terms of how breaking the sickle cell cycle came to be. And I entitled it Breaking the Sickle Cell Cycle because that's exactly what we do. We provide education to help empower people to make informed healthcare decisions with the intent that that information will help you break the cycle of sickle cell disease.
Love it. Love it. So, I'm sorry that you had to find out in that way. I know that had to been a roller coaster, of emotions. Um, but I always say that there are no mistakes, and we all have our own testimonies on how we, whether sickle cell, cancer, whatever, everybody has some type of journey that they've had to take to get to where they are.
Right.
And to see that, you've taken, as they say, lemons and made lemonade from your
Mhm.
situation. That just speaks, high volumes on one, your strength, and just the person that you are, you know.
Right.
Um, and then two, the most important part, I always say nobody's gonna advocate for our children like we do.
Right.
So that's another segue on how we got into this, into this field.
Mhm. Right.
Um, but with that being said, so how old is your son, if you don't
He's
mind me
10.
asking?
He's 10 years old now.
Okay, so you've been dealing with this for 10 years, and
10
with
years.
so here at Sky Center for Observation, Treatment, and Transition, our goal is to empower individuals and families transitioning from pediatric to adult care.
Mhm.
So, being that your son is 10, I know the audience hear me talk about it all the time. So, to hear a stranger, and not to call you a stranger, but someone new come on
Mhm.
board, what are some of the things that you teach your son to be able to have a smooth transition? Because I know you do. So, I just want to hear.
Yeah, it's interesting. It's coincidental that this call came, well, this interview came up today because I actually just got home from a hematology visit. So he had to go and see the doctors today. And what I always tell him is one, when the doctor comes into the room, he's not coming to find out how I'm doing. They want to know how you're doing. So we start with letting him answer the questions. Now, granted, I will fill in where needed, but I am not the patient. He is the patient. So even at 10 years old, we try to get him to vocalize and answer questions and talk about what's going on with him. When they ask, well, how's his pain been lately? Don't ask me, ask him. How has his pain been lately? And he can tell you whether it's good or whether it's bad, or if he's been able to do the things that he enjoys to do versus not being able to do them because of sickle cell disease has gotten in the way. um that would be the biggest one, is learning how to articulate what it is that you are feeling, whether it be something that you are emotionally or mentally upset about, because that is just as important as the number of days that your legs hurt. So being able to share what's going on with you as a person, I think, is one of the important things that we talk about him being able to do. The other piece of that, and I know a lot of people have issues with this, including on the adult side, and that includes needle sticks and trying to get blood drawn. Well, for him, there are certain things that we do, and as far as prepping to get those things done. So, of course, we've got the lidocaine numbing cream at home, or even if we don't have it at home, when we get there, and if he wants the freezing spray, which again is just another numbing spray that they can use right before they stick. I tell him, I was like, if you want that, you tell the nurse before they get started. You tell them exactly what it is that you need to help this experience more positive for you. And for a
Right.
lot of people, they oftentimes, it's hard to find the access point to get the blood. So at our hospital, they have that ultrasound, or I think it's like a UV light that they can shine on. So
Yep.
that's what I've gotten him into the habit of doing now. It's like, okay, when we get here, I need you to tell the nurse what it is that you need. If you need her to get the light so she doesn't have to stick you, more than once, tell her to get the light.
Yep.
If you need the numbing spray. So again, those are small things that make a huge difference when it comes down to how this experience is going to be. Because again, drawing blood, that's just part of the course. This is something that's going to happen every time you come. So you might as well use the tools that you have to make this easier for you and for the person who is trying to help you in that, healthcare provider role.
Yeah. Yeah. So you just said a lot of the things that I that I always tell the audience or the patients. I think it's important for children start it we have to start young, like empowering them
Right.
while they're young. I do not believe in telling them what they can't do. I do say you have to do things in moderation
Mm-hmm.
so that they are mindful, but that's not to say that you can't do it. It's just being mindful of how much you can do at that time. So to hear you say
Mm-hmm.
that you're having your son have the conversations with the hematologist, I think that's important, as well as knowing their dosage or what type of sickle cell. You'll be surprised how many people don't even know what type of sickle cell they have.
Right,
Um,
right.
so I say these things because I want to keep reiterating why it's important for patients to know their the diagnosis for themselves, because they're already going to
Right.
have what, as they get older, they're already going to have stigmas associated with their chronic disease. Unfortunately, that's
Mhm.
just the reality of it. But
Right.
to be informed, to know what you have,
Right, and to
nobody.
know what you need is knowing what works for you, because sickle cell
Yep.
disease is so different. And what mixture of medications that may work for one, it may not work for
Yep.
somebody else. So you need to know that when you encounter a healthcare provider that says, well, so and so takes this and they, are fine. Well, that person needs to be able to advocate and say, well, I'm not so and so. This is what
Yep.
works for me. And this is what I've been doing over the past however many years that this person has done that. You need to be able to speak for yourself and not just go with the flow because that's the way the flow is going.
Right. Right. I agree. So, how have you? Okay. So, be that we're in sickle cell, and then I heard you say you have the pharmacy side that you do.
Mhm.
How do you disconnect, or do you disconnect? Does it all intertwine with one another? Do you shut it off at any point?
No. No. I mean, I can't because it's a part of my life, because it's a part of my son's life. It's a part of my life. So the things that I do in pharmacy, I'm always researching stuff, trying to find what works, what can we tweak, what's on the cutting edge, what's developing now. it. No, I do not turn it off. And I
Yeah,
don't think I can. I would,
that's
even
my
if I could, I wouldn't, because that means there's something else that could be going on that could be helpful to my son or somebody else that I'm missing out on. So,
yeah,
not to say that I obsess over it, but because what I
yeah,
do is part of my job and it's a part of what I do in my life. So
yeah,
they are intertwined. And I think, like you said, God makes no mistakes. He set it up this way. He set it up so that I could understand the ins and outs of healthcare and pharmacy and disease state management so that I could be effective in this sickle cell space.
yeah, yeah. That's my struggle, and I don't want to say struggle, but it is something that is very hard for me to do. Like I'm always looking for ways. Well, we can talk about this, or we can do this, or and that is what and I always say this because you talk about research. That's really what led me to even go pursue a doctorate.
Um,
Because I knew if I research or if I did a research on something that I was already doing the work. It just made sense to
right,
go degree behind it. But I said, if I'm doing all of this work, I want to make sure that I'm bringing something back useful.
right.
One, to help not only my kids, but all the patients that are affected by sickle cell. And
Mhm.
then how I can bridge the gap in making something happen or creating some type of programming,
Right,
behind.
right.
So it has to make sense. Like if I do anything, it has to naturally fall into what it is that I'm already doing. So it don't
Right.
doesn't feel like work. So I'm pretty sure you don't feel like it's work all the time because you just go because people ask me all the time, how are you doing all this stuff? And it's like honestly, I don't even think about it. I'm just doing it because I know it needs to be done.
Right. Right. I agree with you 100%.
So so I'm glad to hear I'm not alone on that issue. But so what do you have? What are you working on right now? Like, do you have something coming down the pipe?
Oh
That we can.
gosh. Yeah, that's been the hot topic. And I'm super, super, super excited about it because yes, we do. We are actually planning for a caregiver day. So as we're sitting here talking about our kids right now, caregivers need care too. And I know we've heard that 1,000 times, but until you actually stop and take care of you, that's
Yeah,
just going to be a saying that you keep hearing 1,000 times. So I really want to focus, like help our parents understand that we're not losing sight of them and helping them to understand they are just as important in this process as the child or the loved one that they're taking care of who has sickle cell disease. Their healthcare is important as well. So we're planning to do a caregiver day in June. I think it's after Mother's Day, before Father's Day, because we didn't want to compete with either one of those, but we wanted to make sure that um, anybody who's a caregiver is included. So that's an event that we have coming up. I think it's June 10th. And
okay.
then we have an event here in Clarksville that we're working with. I think it's the group that's called Manifest Magic. We did it last year for Juneteenth / Sickle Cell Awareness Day, where we participate in the activities by way of providing sickle cell disease trait testing through a partnership that we have with 23andMe. So again, that's another one of the things of breaking the cycle is allowing people the opportunity to find out what their sickle cell trait status is. And we can do that through offering the 23andMe testing kits. And not only does it test for sickle cell traits, but it also tests for other healthcare conditions that a person may be at risk for just based on their DNA. So the information comes back and it lets you know if you're at risk for things like kidney disease or certain types of cancer like breast cancer, Alzheimer's, diabetes, you name it. There's a slew, I think it's like over 65 tests that can be picked up on, or your risk can be detected just based on your DNA. So that's a event or promotion that we have currently ongoing, but that's something that we'll be sharing again at our Juneteenth event. And then we have an event in July where it's called Meet Me at the Park. That's for the kids. We bring the kids out to an indoor trampoline park because in July it's hot, and we want to make sure that the kids with sickle cell disease have the opportunity to enjoy, being out at a park, just trampoline park. It's indoor, having fun, but we also provide an educational session for parents during that time to learn more about what's going on with their child's sickle cell disease. And because it is during that time that's right before school, we talk about educational supports that are available for kids who have sickle cell disease that can be utilized in the school system.
Mhm.
So and then we have in September our 5K is coming up. So the
Okay.
5K Sickle Cell Warrior Walk Run, this will be our third year doing it now. So that's in a nutshell. Those are our big events that we have. And we also, like during that time span as well, we partner with local organizations in the community and, hosting blood drives or doing other sickle cell trait awareness activities, things of that nature. So our calendar is full, it seems like. So when you
Yep.
ask me what do I have going on, it's like, as you said, the wheels never stop rolling around here.
Yep. I can only imagine. We have a question from the audience. They
Mhm.
said, "How is adult care for sickle cell where you live?"
Where I live, it is no exception. The same concerns that are in existence at other places, sickle cell treatment centers across the country, are in existence here. We have patients that do have very long wait times. We have patients that sometimes they may show up, they may be seen, but they may not get the adequate pain medication, or their needs may not be addressed as they should. For the adult side, what I can say is just trying to be, and I know that patients who have sickle cell disease, they are, but just being as prepared as you can, making sure you've got your care plan, in hand if you end up going to a place where you may not normally receive care, or even if you go to the same place and the people that are there on that shift, they may not have seen you before. They may not be knowledgeable about sickle cell disease. Making sure you've got your care plan that you've developed with your hematologist and that says this is what you do, step one, step two, step three.
Yep.
Making sure you got your list of contacts. Like if you're not getting the care you need at the hospital where you are, do you know who to reach out to right then and there when you're at the hospital? Do you know who the patient healthcare advocate is that could speak on your behalf, or that could help you if you're experiencing a challenge with receiving some, healthcare services? So where I live, like I said, it's no the same concerns that are in existence nationwide are in existence where I live as well.
Yeah.
It's sad. It is very sad.
It is.
Um,
It is. I remember having a talk with someone previously that came on. We just wonder if it ever going to change because we think
it
of
will, it will. But the only way it's going to change is if you get involved in sickle cell disease legislative advocacy. That is the only way that I think we are going to see the change that we want, is if we get laws written that are specifically for the sickle cell community. And I say all that to say because I just participated in Sickle Cell Disease Advocacy Day on the Hill
hmm
about 2 weeks ago now.
Yep.
So in your areas, if when the opportunity arises and you hear about Sickle Cell Day on the Hill, talk to your local representatives because they work for you. And if you don't make your voice heard, and if
Yep.
you don't make these things a priority to them and let them know that these are things that you care about, then we can have all the awareness days that we want in the community. That's just where it stays. All those efforts stay siloed in the community because the legislative bodies are not aware of what's going on. And I'm not going to say you're going to have one conversation with your state representative and all will be well. You have to keep knocking on that door every time the opportunity presents itself. And I say that because what I heard in regards to other rare diseases and why other rare diseases get the attention that they get is because they have a body of people who support their cause, and they will shout from the mountaintops 365 days a year what their causes are or what's important to them in regard to that rare disease. They make noise, and how they say the squeaky wheel gets the oil. That's why some other disease states get more attention and focus, is because they have a large body of people advocating for them. And I think that in the sickle cell community, we have just as many, if not more, people than any other disease state that is represented out there. And if we speak with a unified voice as to what's important to us, I think that
Yep.
our wheels will begin to get the oil. But it can't be, we're talking about it over here in Tennessee and Ohio, but nobody's talking about it in Arkansas. It has to be a unified,
Right.
collective voice to all of the state representatives that this is something that's important to us.
So you're the second, maybe third person that said that they can't. So I asked them each this question: how do we go about doing so? Because at same Capitol Hill, I joined virtual, so I was able to look at legislation that way. But how do we make that happen? You know,
I would say you
is
don't
it
want to
something
do
that we
it
should?
independently. Uh-oh. I think we may have a delay. But I think your question was,
Sorry.
how do we do it? How do we get involved?
Yes.
Okay. So you don't want to do it independently, because one person making a stance is kind of like you got one person speaking by themselves. I would say get connected to your local sickle cell organizations that are connected to other national organizations. Uh-oh. I think we lost LaCharde. Uh-oh. Maybe she'll come back on in a minute. But if anybody else is still listening, can y'all send me a note in the chat so that I can, let me see. So if you're wanting to get involved on the legislative side, I would say partner up with other organizations in your area that may be already speaking to that same topic in terms of sickle cell disease advocacy. And the organization, okay, see, you're still listening. The organization that you partnered with, they may be partnered on a national level. So hi, LaSharde. I was still talking. I didn't know if you were able to come back and join us or not. But I was
I
saying
lost.
that you should partner up with local organizations. So what we just did for this advocacy day, it was actually three different organizations. It was the SCDAA, it was Six Cells, and it was the Sickle Cell Consortium. So if your local organization is partnered with one of those national organizations, then those national organizations are the one that present this unified front of the voices of the sickle cell community. So you don't want to be a lone ranger out there by yourself, because when you speak with a collective unified voice, it has a louder sound. So I would say if you want to get involved in sickle cell advocacy, make sure that you're connected with one of those national organizations. And through those national organizations, you will there have your connection to the advocacy space. Because I know in the consortium, the Sickle Cell Consortium, there's actually a legislative committee that you
Yeah.
can be a part of. And I know they have that in Six Cells as well. So there
Yeah.
are a number of ways to get connected. You just have to join and, get in, like how they say, get in where you fit in. There are plenty of opportunities to get in and do legislative things on that note. And then in your local area, if there is a sickle cell organization in your area and they're working locally, they typically have a day on the hill. Like I know in Tennessee, we have Rare Disease Day on the Hill. And of course, sickle cell disease would be in that umbrella. So if in your area there's not a specific sickle cell organization, then you can partner up with Rare Disease, because y'all are working for one and the same efforts and trying to get things done. And then if there is a sickle cell organization in your local area, then you can make sure that you get it connected to your local organization, and your local organization can take advantage of the local day on the hill as well.
Yes, thank you for all of that information. And hopefully the viewers that are watching, they will go join some type of support group to help those
Mhm.
individuals. And I can't stress that enough, because people think the support groups are just for individuals that have sickle cell disease, and that's really not the case. Um,
No.
I think that I just wanted to stress that, because I want people to understand there's so without the help of others that do not have sickle cell disease, sometimes it's
Mhm.
really hard for those patients to do some of the things that individuals who don't have sickle cell can go and do, because their bodies are already rapidly breaking down those red blood cells, and they're extremely exhausted or fatigued. So
Mhm.
sometimes they need some other.
Advocates.
Yes,
Advocates. That's exactly what we need. It takes an army. And we need people at every level.
yes, yes, yes. So, okay, so we talked about quite a few things here. So,
Mhm.
let me ask you, are you prepared to have the uncomfortable conversations with your son? And what I mean by
Yeah, like
uncomfortable,
what's uncomfortable?
and maybe I'm putting my feelings on you, so I apologize. So when we talk about the priapism,
Okay.
and because he's 10, so
Mhm.
eventually he's going to be a
Mhm.
teenager. So just having those types of conversations, are you going to have the conversation, or are you going to let dad have it, or y'all going to do it together? Like,
I think it would be like I'm gonna have it. His dad's gonna have it because we both have our own perspectives that we bring to it. I'm gonna bring to this the perspective of this is what it is. This is a physiological response. So I don't think that we should categorize it as uncomfortable, because to me that gives it a negative connotation off the top, because this is uncomfortable. This is a part of what's going on in your body. This is a physiological response to your red blood cells blocking blood flow in this particular area of your body. Just like if you had red blood cells that block blood flow in your legs and your leg hurts.
yes,
This is no different. And I think that when it comes down to discussing things of that nature with children, this is where you have to call a spade a spade. When they were talking about, how do you introduce body parts or genitalia to younger kids? You don't call it these fluffy names, because
yeah,
then I think it takes away the seriousness of what it is that we're talking about. So no,
yeah.
we're gonna call whatever your genitalia is, you're gonna call it by its name. And when it comes to sickle cell disease, this is how your sickle cell disease impacts this particular part of your body. I think that we as parents put our own associations on it, because
Yep.
kids don't know. They haven't been here before. They're brand new. All they know is, something's going on and it doesn't feel right. That's what I
Right.
think that we should be relaying to our children. If there's anything happening, no matter where it is in your body, as it relates to sickle cell or anything else, then you need to be able to share that feeling, whatever that is, and then we can do something about it. When you are
I,
for me, if you approach it that way, then there is no uncomfortableness about it, because you would have went into the situation from the beginning explaining to your child about their body parts, genitalia. There's nothing uncomfortable about that. That's just your part of your body.
yeah, and I like the way you summed it up. Maybe the word choice wasn't the best, but I know for me sometimes it's different, because one, I have all boys, so
Uh-huh.
like I think it's like the approach, or what way should I do it. I'm mom, so like and my boys are very very vocal, so it's like, am I gonna be coming the right way? And I think dad just has a better angle when it comes, and then I'm able to come in on the end part, like, well, this is what it is. So
Well, that's
sometimes,
why I said it takes two. It takes two people because you're gonna have different perspectives. Now, exactly what goes on in that part of your body, I can't tell you. I have not a clue. But what I can tell you is that this may feel different. This is what sickle cell does. If
yeah,
something is going wrong or you don't feel like this is right, then you should tell me and we can do something about it. Now,
yeah,
exactly of what that feels like and the intricacies of it, well, it takes two, and that's where, from a male perspective, it
yeah,
would, come in.
yeah. Yes, but I love the way that you kind of brought that back. So yes, it's not uncomfortable. It's just a conversation that needs to be had, but just got to figure out how that's gonna look.
And I think everything, like how you explain to a 10-year-old is not how you would explain to a 16-year-old because their
Right.
minds, their developmental processes are so different.
Yep.
So you explain it based on the level of understanding of the age of your child,
Yep.
and you leave it at that. And then and sometimes you let the child lead with their terminologies. So therefore you're not reaching for some words and explanations that are far beyond their level of understanding anyway.
Yeah. Yep. I like that. So I'm gonna have to take that approach. Um, yeah. So I when I tell people who do not have to experience what we experience on a day-to-day basis, I don't think people understand like it's a whole process. Like,
Mhm.
and I use that word because it is. It's literally like I have to plan everything accordingly. Like it's not like we can just get up and go. Like there's always some extra details that comes with that. And I
Right.
don't know if you feel that way, but
I do. I'm gonna tell you a story about all this planning that we do. I think last year I was going to the Foundation of Sickle Cell Disease Research Conference down in Florida.
okay.
So before you get to go somewhere, you pack all your bags, but that's not the end. You got to pack heating pads, you got to pack pain meds, you got to pack everyday meds, like for whatever. So we have this medicine bag in addition to our regular luggage bag. Well, I always keep the medicine bag like with me at all times. So I need it, so I have easy access to it. Well, I get to the airport and I realize I brought everything except the medicine bag because I left the medicine bag in my car at the place where you park your car. And I realized that as I was sitting at the gate waiting for our plane to get ready to board, and I was like, oh my God, I have left the daggone medicine bag. So forget all this other stuff. How did I leave the medicine bag? And that's because I was so busy trying to get all this stuff done, trying to be superwoman and carry it all out. Now, luckily, I was able to call. This is why you need a network of support people to help you because you cannot do it all. I was able to call one of the people in my support circle. I told them what happened, and they were able to go by the parking place, get my bag, and overnight it to me the next day. So he didn't miss any medicines. But that just goes back to the point of we cannot just get up and go because we feel the need to get up and go. There's a
Yeah.
lot of I's that have to be dotted, T's that have to be crossed before you can, enjoy business as usual, like most people would do. And it just becomes a way of life.
Yeah. Yeah. We got a question here. On the pharmacy side, do you see or know of more breakthroughs for the future of sickle cell treatments or medication options? Also, are they affordable?
Yes, there are a number of medications in the pipeline for sickle cell disease. I'm so excited because new monies have now been authorized in the government allocated towards sickle cell disease research. So now we're finally at the point where we're going to see more medications coming to market. We started initially, I think in 2017 was when Endari first came, and then we got Adactio, then we got Oxbryta. Well, they're coming out with more. And even now, I just heard last week as far as gene therapy goes, Vertex has submitted their submission to the FDA to be authorized to have the first curative therapy for sickle cell disease by way of gene therapy. It came relatively early. Initially, we thought it was going to come out third quarter of this year, but it actually went to the FDA last week. So I'm super excited about the opportunities that gene therapy will present. Now, as far as those medications being affordable, this is where you have to continue to advocate on your legislative side of things, in addition to within your own personal insurance plans. Because, yes, these medications may be available. The barrier or access barrier is going to be how the insurance company decides that it will cover these medications. Will it be something that's preferred? Or will it be non-preferred? Do you have to pay your regular, whatever your regular copay is, or do they make you pay the extra tiered copay? That is where we need more people to continue to advocate as to why these particular therapies are important for their loved one. Um, and only time will tell. I think that the more the legislative bodies get involved, then we get CMS involved in whatever. Typically, what CMS provides, and that's the Center for Medicaid Services, what they provide assessment and allocation for by way of sickle cell disease treatment, then your other managed care payers tend to follow suit based on the guidelines that CMS has established for sickle cell disease treatment. So that's a place where you definitely want to stay in tune. I've been involved in that process myself in terms of access issues. My son is on Oxbryta, but I've been trying to get him on. He's been on it since October now, but I had actually have been trying to get him on Oxbryta since like a year ago. Like not this past October, but the October before that. And I encountered so many hurdles just trying to even get it. And the hurdles are all spectrums, from all spectrums of every person that you have to interact with that takes care of your child. It was a hurdle. But this is why I say education is empowering. The more education you have, the more armed you have to make the case for why your child or your loved one needs a particular therapy. You need
Yep.
to be able to follow what your loved one's laboratory results look like, because I know sometimes what we see on TV, that what we call direct to consumer marketing. You see a commercial on TV and it's like, oh, I want to try that. Well, that might be great, but the way the system is set up, there are checks and balances and things that have to take place in order for you to even get access to that. And if
Yeah.
you are already keeping track of what your particular loved one situation is in regards to, number of hospitalizations, number of VOCs per year, what is really needed, to help them get to that next level? What are their normal baseline laboratory values looking like? How will this medication benefit them? So if you can answer those questions, I think that it makes it a little bit easier for you to gain that access, but just be prepared to go to war for your loved one.
Yeah. You
I
said
hate to put it that way, but I mean that it is what it is.
we've been on the path. My boys are both on Oxbryta, but they also take hydroxyurea. And
Mm-hmm.
we've been on this PAP program. It'll be a year. Actually, it'll be a year this month. But now I'm gonna have to go through it all over again
All
because
over again. Yep.
because one, the insurance that we had has changed.
Mm-hmm.
So now we gotta go through this process again. But I was under the impression that it was only supposed to take a couple months. That was not the case. Um,
Mm-hmm.
and I'm not gonna complain because we haven't had to pay for it. But my fear is what happens next because
What
we know
happens next? Right.
that is my fear. And it's like it's working for them. This should be a no brainer. This should be something that the insurance
And
company
I
should.
think that is what you just said. It's working for them. So if you can make the case of prior to them starting, they had this many hospitalizations, they had this many VOCs, their hemoglobin level was this. Now that they've been on it for this, for a whole year, this is how they have improved. At
Yeah.
that point in time, most insurance companies, you will have made the case for why you need this therapy. And it's unfortunate that we have to go through all these hoops for like 4 medications, because it's not like we have a lot to choose from.
Right.
But you do have to be able to show that there was a benefit. And you may have to go through that prior authorization process, but that's why it's called the prior authorization process. It's a process that you go through, you and your provider submitting the necessary documentation that shows how your child has benefited from this, and to take this away from them or to deny them access would actually be a detriment to their health.
Yep.
That's not a situation that anybody wants to be in, especially the insurance company, in that regard. But you may have to write it all up. It may not be just a simple conversation. You may
Yeah.
have to, dot some I's and cross some T's and make some phone calls. But that's, again, that's part of the process.
Yeah. Yep. Well, I'm definitely gonna do that. I just know I gotta go through this all over again. And I made a case. I sat on a call before where there were like a lot of pharmaceutical people, and I made this case. I said no person should have to pick medication or housing or medication
Mhm.
or food. And that's really what it comes down to. People are having to decide
Mhm.
which route to take. How is that, you know, how is that? How is this? We're not I don't know. I think the United States is one place where we should have free access to healthcare and all these things, but we do not. Yet we got all these people in California, all parts of the world, living in poverty or homelessness. We know the population
Mhm.
is huge, but you're telling me you can't approve a medication that could potentially save one's life, or at least
Mhm.
create some normalcy, because that's really what it is for these patients, and this firsthand. We want to
Right.
just some form of normalcy. They're already trying to survive every day
Right.
living with this chronic disease. So it's kind of like we got to meet somewhere in the middle. I understand that's a business, but this is life too. So it's kind of like which one is more
Yeah. And you know how that the saying goes, don't hate the player, hate the game. And in that respect, we know what this game is. So therefore, arm yourself with as many tools as you can to get you as far ahead in the game as you can get. And when I say that, I'm referencing, if we know that this is the way the game works, then that means we need to have everything that we need in regards to what does the insurance require for me to get this. Okay, let me start checking out these boxes long before it's time for me to actually need this, because it's going to take, I'm going to say, give it 90 days. It may, get taken care of sooner, but I'm going to say at least 90 days for papers to get to whoever they need to get to, people to sign off on things. So therefore, when you actually need it, then everything is already in play. All the permissions have been granted, and now those roadblocks have been removed. Until we have that
yeah,
free access to healthcare, that would be, ideal. I think that educating yourself and empowering yourself with the tools you do have available, it's going to take some legwork, and you got to do things ahead of the game. But I mean, that's the payoff. You get the outcome that you're looking for, or you're more likely to get the outcome that you're looking for if you prepare yourself, get started early, and stay consistent with that messaging.
I like that. So I want to leave on this note. If you had to give advice to a new mom or dad, what would be the advice that you give this parent?
Stay in the moment. That stay in the moment It's something that I have to remind myself, even now, 10 years later. And I say that because when my son was young, I would do all this research. I would see what everybody else is doing. And then you get all these stories, and it's like, oh my God, this is going to happen. That's going to happen. Nobody knows what's going to happen from one moment to the next. So tomorrow, will take care of itself. Stay in the day. Let your child be a child. Of course, you're not just let them run wild and run free, but just know that your child can do whatever it is that your child wants to do with modifications, and making sure that you provide them with the necessary things that they need to be as close to normal as they can be. And don't be afraid to let your child be a child, and you don't be afraid to stay in the moment.
Yeah. I like that. I could have used that, honestly.
Yeah,
When I
but that is so important when it comes down to crisis and you're in the hospital, because that's the moment where where your faith is tested, who you are is tested. You don't know if you're coming or going, and it's like, look, what's happening right here, right now?
Yep.
Are we addressing that? That's the only thing we can worry about. When
Yep.
tomorrow comes, we're gonna do the same thing tomorrow. But what we're not gonna do is worry about 3 days from now, today. What's
Right.
gonna happen 6 hours from now at this very moment? That
Yeah.
will drive you crazy.
It will. It will. And you have to let them live. You have to allow them to be who they gonna be. They gonna do that anyway. They gonna do that whether we want them to or not. They're gonna do it anyway. So
Right.
I definitely I love what you stated to our audience. I just thank you for coming on. I want the people to know where they can follow you. I already put it on here.
Yep,
Instagram,
that's it.
break the sickle cell cycle. This is so
It's
BRKTHESSCYLE.
like,
Yes.
yep.
Follow her. That's on IG. Now, do you have you
That's
got a
everywhere. That's Instagram, Facebook, and Twitter. They're all the same.
awesome. So y'all follow her. I follow your page. That's how I met you through your page. So I'm all about sharing other people's story, resources. I just appreciate you taking the time out your day to come on here, talk to my audience. We learned a lot today. I learned a lot, you
Oh,
know.
good. Good.
So I just want to make sure that we stay in contact moving forward.
Uh-huh.
And whatever you have, just share, and I'll make sure I share it on my platform. I think we got somebody saying something
Yeah.
here. Oh, they said great conversation, great information. Absolutely. Um, so thank you for your time. Audience, tomorrow we will be back. We will be back here with Andre Harris. You know Andre Harris.
I do. I do. Now, we want to talk about legislative advocacy. That
That's it.
is the man. That's him. He is, paving his own way. I'm so proud of him.
Yes, he is doing his thing. That's a little brother. That's what I call him. But Andre will be here tomorrow. We're actually going to come on at 2 p.m. Eastern Standard Time tomorrow. We know that that's Good Friday, so we're gonna move a little earlier. So 2 p.m. to 3 p.m. tomorrow. Same spot, Facebook. Follow the YouTube channel, Scott Center OH. We will see you guys tomorrow. Thank you again, Dr. Scott.
You're welcome.